Hello, America. I'm here to introduce the Shushabye Airway. My name is Dr. Charles Baldwin. I spent 45 years in medicine, almost 30 years as an anesthesiologist, but I was also certified in pediatrics and emergency medicine and was a chief flight surgeon in the Air Force Reserve. I also had special training in hyperbarics, so I'm kind of an expert on ventilation, oxygenation, and breathing. And I'm here to introduce an airway that I've developed and I have a patent for called the Shushabye Airway. And here it is in 5 forms, and it will come packaged clean in individual packages like that. This is the 2 adult sizes down to an infant size. The airway works by pushing forward your maxilla on your mandible and emulating the maneuver that anesthesia providers make called the jaw thrust maneuver. And it's put in place by articulating with both dental ridges, right here. And it's made out of material that is soft enough you can squeeze it and it helps articulate with the ridges. The other characteristic of this is a wide awake person like I just did can put this in. So it's a unique airway compared to the other more invasive airways used to support the airway, like nasal airways, which is this. These are oral airways made out of very hard plastic. This is a Goodell airway. This is a Berman airway. These are endotracheal tubes, which are placed in the trachea to breathe. The ultimate airway is a tracheostomy tube, which is shoved down a hole cut in your neck. The unique quality of the Shushabye airway is that it opens the upper oral airway without gagging or choking, as these things would, the patient. So it can be used at the light levels of anesthesia. In 35 years of anesthesia practice, I realized that one of the missing parts of anesthesia is when a patient is very lightly sedated or on a very light general anesthetic, what happens is their airway reflexes are still partially intact, but discoordinated and don't work properly. And at this stage, 2 things can happen. Their upper air, if you don't have an airway in them, they may obstruct their upper airway. But if you put one of these airways in them, you can get a very bad, even dangerous reaction because of the discoordination of the reactions and reflexes that are in the larynx and in the airway. The innervation of what we can call the airway, that is the mouth, the hypopharynx, the larynx, which you can see here. This is sensory and motor innervation. A large part of the brain is given over to innervating both the motor movements and the sensory input from the airway. This picture is a sweet picture, but it's a little distorted because it really doesn't show how much the larynx, which also has significant representation in the sensory and motor cortex. So this is a very powerful part of the brain in innervation. In deep anesthesia, you don't react, but in light anesthesia, these reflexes will be very reactive. This is the reason why there are post-anesthesia care units, because as a person is emerging from general anesthesia, they will go through this light plane of anesthesia when it's very dangerous. And the airways that are put in can actually stimulate severe and bad reactions like something called laryngospasm, which I'm sure you're all aware of and are terrified of. The uniqueness of the Shushabye airway is it will hold the airway open without gagging the patient or stimulating airway reflexes in any way. Just a couple of quick side notes on the Shushabye airway. It comes in these 5 sizes. It's made out of material that's soft enough, as you can see, that it's easy and pliable to put in, and you can push things in and out through it. But it's firm enough, it has a lot of springiness, so if a patient bites down on it, when they let go, it goes back to its natural, its design shape, and opens the airway up again. It is manufactured in an ISO 13485 certified facility, and it is packaged in an ISO 78. It is manufactured and packaged in an ISO 78 certified rooms. And it comes individually packaged, as you can see here. This is the small adult and the large adult size. All right, stop. We'll see what happens.